Okay, right. So the important things on your blood test, some of your blood count, something called as HB,
Okay.
which is low.
So what is HP, doctor?
So it's a blood count, and when it's
Okay.
low, we call it anemia.
Oh yeah, so okay, so the iron, okay. Yeah, I know anemia, is it not because of the iron.
Yeah, we don't know why it's low. We would need to discuss it. And then there is something, your cell size, we call it MCV, which is
Okay.
also low.
Okay, so I hope that's not something serious, doctor.
Uh, when you say something serious, anything in specific going through your mind, Jessica?
No, not specifically, but most of the people in my age will get cancer or something. I hope it's not a cancer.
I can see you are worried about that. When we see, low blood counts, one of the reason would be, people lose blood through the bowel. Just wanted to double check whether you are having any diarrhea or any constipation,
No, doctor, no.
any
My
tummy
bowel is
pain,
fine. No, I don't have any tummy pain.
any weight loss,
No, no weight loss at all.
any lumps and bumps in the body,
No, I didn't felt anything, to be honest.
and any family history of any bowel problems.
No, I'm not, because I'm fostered, so I'm not aware, to be honest, but I don't think so.
Right. And what about diet is another important thing. Just wanted to check whether you eat a balanced diet, like including fruits, vegetables.
Yeah, I'm vegetarian, doctor, so I'm just eating, vegetarian food. I'm not eating meat, fruit and vegetable for sure I'm eating.
And is there any reason why you don't take meat?
It's just I don't like, the idea about killing another creature and eating its meat, yeah, I don't like that.
Okay, right. And do you think that you are more short of breath recently?
Well, yeah, to be honest, yeah, I feel that more fatigue than when I'm doing my gardening. Yeah, at the end, I feel that I'm short of breath, which is something I was not having from before.
Mm-hmm. Right. And has anybody told you that you look pale? The reason I'm asking these questions, sometimes, with anemia, people, they look pale and they become short of breath.
No, doctor, no. I think I'm still, my color is fine. I think so.
Okay. And are these, you mentioned that, you are out of breath sometimes. Is it affecting your like home life or work life?
Well, not much, to be honest. I'm still able to do the things at home, but it's just my gardening a little bit, affected.
hmm Right. Sorry to hear about that. You mentioned it's affecting your gardening. And Jessica, since I told you about these blood counts, you did mention, cancer as well. I will be making my suggestions in the end. Was there anything you were thinking that we might be doing today?
Yeah, I think, yeah, well, yeah, I had my neighbor who had some iron tablets. I think maybe you can give me some iron tablet because if you told me eat meat, I will not do, to be honest, doctor. You can give me some iron tablet, and then if you can just specify it can be vegetarian source of iron, this I think it's maybe applicable, yeah. And even if it's not, I will buy it over. Yeah, I can pay for it, no problem.
Hmm. Yeah, you are right, Jessica. We do give people iron tablets when there is iron deficiency, but the important thing is we need to find out why you are having this deficiency.
Okay.
I know you mentioned diet, which could be a factor, but we need to exclude other things. Just wanted to double check with you, Jessica. Normally, we do bowel screening, when we turn 60. Just want to check whether you have had a special test which comes in a post. Have you had that?
Yeah, they send me one, and then and I did it, and they told me it's negative, it's fine, I think. Yeah, they told me it's fine, I guess.
Okay. Right, right. That's reassuring. And smoking and alcohol history, it can affect our health. And I can see you are having pre-diabetes and hypertension. That would be relevant. Just wanted to check whether you smoke or drink.
No, I'm not smoking anymore. I used to, and I stopped. And drinking, well, perhaps every now and then I'm drinking a couple of glass of wine, but rarely.
Mhm. Well, Jessica, based on our discussion today, I mean, the possibilities going through my mind why you are having this low blood count. One could be, that you are not taking meat. So that could be contributing to this low blood count. And we need to address that. The other possibility going through my mind, I know you mentioned you don't have any bowels problem, but and again, I'm not saying that this is applying to you, but we need to rule out serious bowel problems
Okay.
by doing repeating that fit test again, which you have had, as you mentioned earlier.
Okay. Well, is the same one?
The same one, just to make sure we are not missing any serious causes like cancers. And again, I'm not saying that you have got cancers, but you did mention earlier about cancer, so that is something we don't want to miss it.
Sure. Yeah. No problem, doctor. Yeah, I can give you shampoo. Yeah. No problem.
And how about doing some further blood tests as well? We call it iron studies, like checking your ferritin levels, checking your iron levels to see whether they are low.
Oh, yeah. No problem, doctor. Yeah. I'm happy to do that.
And I was meant to ask you earlier, Jessica. I can see on your record in 2018 you have had a camera test from down below. Do we know the reason why did they do it?
Well, I think I had some, I had some constipation diarrhea. And
Mhm.
then they said they want to check if there's any problem there. And thankfully, they didn't find any serious thing. Yeah.
Okay, okay, that's reassuring. And you did mention that, whether we can suggest you some changes to your diet, like in terms of vegetables, which are rich in iron. I'm just wondering, how about, trying some leafy vegetables like spinach that contains iron? Would that something you would be able to do? And dairy products, they do contain iron as well.
Yeah, that's fine, doctor. I will do that. I will do that.
And there is a very good websites for dietary modification. How about I send you a link and it will tell you loads of options in terms of like vegetables which are rich in iron.
Yeah, yeah, I will be happy to do that, doctor. Yeah.
Have you got any questions so far
No,
before I
no,
go
no,
further?
no, it's fine. I'm happy to hear from you. Yeah. Look.
Mm. And would it be possible if you can come to the surgery? And the reason I want to bring you in, just to make sure that we are not missing anything, to check your tummy for any lumps and bumps, and also check your neck and armpit for any swelling there. And
Yeah,
I'm also wondering, when we bring you in to do a back passage examination with the finger, just to make sure there are no swellings down below.
yeah, sure, doctor. Yeah, no problem.
We will offer you a chaperone as well. Do you think you will be able to come today? Is
Yeah,
that
yeah,
possible?
yeah, sure. I will come, doctor. Yeah, I will come.
And I mean, there is another important thing on your blood result, cholesterol. But I think we how about, I also book a follow-up appointment, let's say in 3 weeks time, and we'll discuss things further, whether we need to start you on something called as cholesterol lowering tablets. What are your thoughts around that?
Yeah, no problem. Yeah, I think I would do whatever you tell me is good for my health. But let's check first, this iron thingy because, yeah, if there's cancer or something, I would be more concerned about it. But yeah, no, no problem, doctor. I would be happy to to follow your path.
Okay, so see you then. Bye bye.
Here then, yeah, excellent. Okay, yeah, yeah. So yeah, I'm very happy. It's just fine tweaks. Yeah, I like you are very calm, to be honest. But let me listen first from you. I'm so sorry for the technical problem. This may put you in some stress. Okay, and to be honest, we didn't record the first bit of your consultation. Unfortunately, I forgot to open the recording. But in general, I was happy. Fine tweaks. But you tell me your reflection.
Yeah, I mean, the biggest mistake when I was going through the data, probably, maybe, I mean, the font was reasonable, but I missed the hemoglobin and MCV, which was
Mm,
the main important thing in the script given to me. Uh,
mm,
I
yeah.
mean, the moment, I just wrote down on my whiteboard like
Mm,
65-year-old with microcytic hypochromic anemia. So cancer was on top of my head, and I thought
yeah.
I will gently verbalize that.
Yeah.
And then, I mean, anemia could be due to gazillion causes.
Mm,
So I
mm,
tried to ask, like, any is are you losing any weight or any lumps and bumps,
mm,
just to see whether it is lymphoma or anything like that. And then diet, you were volunteering it yourself that you were not taking meat. So yeah, I think could be dietary deficiency, could be cancer, mm, could be we may not even find a cause, but uh,
yeah, yeah,
that
yeah,
is what.
you are absolutely right. You are absolutely right. It's just the other things that you may, I think you just forget that you want to do in also the SCR for her, and
Mhm,
perhaps urine dip, okay? And I will explain why, the urine dip specifically.
mhm,
I didn't also, you did ask her about bleeding from her back passage, but then don't forget the front passage as well. Okay, I know that you know that. It's
mhm.
just one of the things that you need to nominate it because it's important in the differential. Okay, or we tell her, do you bleed from any part of your body? So, and then
Yeah.
we'll include everything. So urine, back passage, and vagina epistaxis. So you may just summarize it in one word, and that would be sufficient. Okay, in the sake of the long differential diagnosis that you may have. The
Okay.
other things, yeah. So whenever we have a case, yeah, let's take it from the start. So you did use the pre-existing information. That's
Mhm,
marvelous. You did reflect on her initial feeling that she worried that why you are calling her. Usually the things are done smoothly
mhm.
and automatically without, returning back to her. And I like that. So this is part of the active listening. So your active listening is excellent. Okay, you did you did ask about the ice in non-formulaic way, and this what will be optimal for you if you keep doing that every day. I'm sure you will nail it in the inshallah in the exam. And then you did mention to her why you're asking about the bowel changes because she may lose the blood there or maybe some growth there. Okay, but you need just to make sure that not every growth is a cancer. But I think when you said the cancer, you say it in a way that didn't make me feel worried because I feel that the doctor know what he wants to do and he know what the next step is, and then I'm in a safe hand. So this was didn't make me irritated, to be honest, but just say growth. One of the, and what I'm saying growth, it can be simple growth like a polyp, or even if you have diverticular disease, which is wrinkling of the mucosa covering your colon, or in rare cases can be, unfortunately can be sinister growth like a cancer. So you need just to nominate what the possibility of the differential, because not every fit test positive is a cancer. Yeah. So if the patient is not clear about that, she may think, okay, if it is positive, now I have a cancer. No, then you need to make that clarify that, yeah, this is a possibility. If the fetus is
Mhm.
positive, we may need to do another colonoscopy. Just the small tweaks. It will not be a big, not be a big loss even in the normal consultation. Okay.
Mhm.
You did ask about the dietary habits. You did ask if the familiar causes of microcytic hypochromic anemia. I'm not sure. Did you ask about the familiar thing because you know that it can be there is familiar issue regarding microcytic hypochromic or just a routine question?
F- Familiar, what are you thinking of?
Well, yeah,
Some
running in the family. So
abnormalities?
yeah. Would you did you ask it because of the cancer or you know that there is microcytic hypochromic anemia can be running in families?
No, so I asked mainly due to bowel issues. I thought whether any
Okay,
bowel
yeah, no,
problems in the family.
got you, got you. No, also microcytic hypochromic anemia can be thalassemia, can be sideroblastic anemia, can be sickle cell anemia. So these can run in family and will show as microcytic hypochromic. So just for your information, I don't think it's a big loss there. Okay. And the other thing that it's you may mention that she had a chronic diseases. She has a pre-diabetes, chronic CKD. Yes, they are controlled, but you know that chronic diseases can cause microcytic hypochromic anemia. Okay,
Mm.
so and this is called functional iron deficiency. So you can have actual iron deficiency and you can have functional iron deficiency. Functional iron deficiency means that you have the iron but you cannot use it, and we
Mm.
will explain why. Okay, in the chronic diseases, the liver will start to form what's called hepcidin, and the hepcidin will prevent. So basically, when you have old RBCs, the old RBCs are being eaten by the macrophages in the liver and in the spleen, and then these macrophages will start to release the iron, okay, that they obtain from the hemoglobin. But then, because of the hepcidin, that will prevent the macrophages from releasing the iron. So you will have normal iron store. That's why you are doing ferritin. So if the ferritin is normal, that can be chronic disease anemia related to microcytic. But if it's low, then that's true iron deficiency anemia. So that's why you are doing ferritin to see the iron store how it is. Okay. And this is just a
Okay.
simple tweak to make understanding of the disease. The other thing that you may consider asking here, to be honest, so the you ask about the severity of symptoms, which is important because according to the severity of symptoms, you would decide this patient need admission or not. So not only the number, yes, hemoglobin is 100. But some people, if they drop suddenly hemoglobin from 140, 160 to 100, this will cause massive manifestation that will make her need admission or even rapid iron infusion therapy. It's just I would love to hear from you that yeah, because of anemia, this can affect your heart, and then if your heart is affected, it will not pump sufficiently, and this will cause you some, leg swelling. So I didn't hear you asking about heart failure symptoms. You ask about the shortness of breath, which can because the decrease in the oxygen, oxygen carrying capacity. And with the anemia, the oxygen dissociation curve will shift to right to the left, and then the hemoglobin will be less eager to release oxygen to the tissues, and that's why the patient will have shortness of breath. But then, is this shortness of breath related to heart failure induced by the anemia or not? It's important because if this is a patient have heart failure induced by the anemia, this patient need an urgent admission. Okay, so I would love to hear that from you if she have symptoms of heart failure. Okay, and
Okay.
explain why. Okay. You had because you had time, by the way, although you had time to explore all of that with your reflection. You did do all the needed reflection. You didn't do exaggerated reflection, and that make you having a lot of time to mention all of these things. So just fine tweaks, but I'm happy in general. I'm happy.
Okay.
Yeah,
Thank you.
I hope that was a good feedback for
Yeah.
you.
Yeah.
The
Thanks.
last
Thanks.
thing when no problem at all. The last thing when you are saying weight loss, please attach to the weight loss if you ask about cancer. unintentional weight loss. Okay,
Yeah.
unintentional weight loss, because the patient maybe lost weight because she's running every day and she want to lose weight. Okay, just make it clear to the patient, not to waste your time. Okay,
Okay.
is
Okay.
that clear?
Yeah.
Yeah.
Thank you. Thank you, Salim. Thank you so much.
Keep no keep the hard work, and I think you are nearly there. Okay, I like your way. Yeah, I admire your way, to be honest. Okay, let me just open the slides. Um, so this is what I want. So the symptom of anemia, complication of anemia, which is one of them heart failure, and the cause of anemia, which is your differential. Okay, and then you can see from this slide the type of anemia. I told pancytopenia need to be referred to the hematology. Microcytic hypochromic, we did the needed, iron study, and the other differential needed for the blood test. You may ask about a specific symptom of iron deficiency anemia, but I think it's an overkill. So you will do the iron studies, or however. So if you have dry tongue or glossitis, or fissuring of the side of the mouth, yeah, you may add that to your differential, but I don't think it will make a big difference. Okay, just in the investigation, fit test, and urine dip, because the urine dip if can show microscopic hematuria, which can denote that maybe there is malignancy in the urinary bladder, and that's why she's losing her blood, and for sure bleeding from the vagina. And this is what the algorithm. So if the ferritin is low, so it is iron deficiency anemia. You need to exclude blood loss, malabsorption, poor diet, which was there. Okay, and maybe you need to add in your blood test celiac disease as well, because celiac disease can cause iron deficiency. So however, you ask about bowel changes, okay, which can cover also the celiac disease. The functional, you just say if you have a chronic disease can cause a functional anemia, and then the hematological, as we said, the thalassemia. Very rarely, a patient can present with microcytosis without anemia, which is something, please don't take it lightly, because it's easily can be missed in real life. Okay, this is trick tip, a trick in real life cases. If the patient have microcytosis without anemia, don't ignore it, please. Okay, don't ignore microcytosis without anemia. Okay, because it can be early sign of hidden malignancy. Okay, so if you have microcytosis, please repeat the blood test and keep your eye on the patient. Okay, and if you cannot explain why he have this microcytosis, you may need to send him to the undifferentiated cancer pathway and let him explore that further. Okay,
Okay.
and
Thank you.
this is the mechanism why the chronic diseases can cause iron deficiency anemia, which you can see that we have something. There is a lot of theories, but the most acceptable from my brain, at least, is that the liver will start to secrete the hepcidin, and the hepcidin will prevent the macrophages from releasing the iron after eating the blood cells. Okay, and like that, you will not forget chronic diseases can cause microcytic anemia, not only monocytic anemia. And then that's the treatment of the iron deficiency anemia. It's iron tablet, and then you check the reticulocyte or the hemoglobin after a month. It should improve by then. Yeah, I think this all what I want to say regarding the anemia. I will just stop the recording 1 minute. Um, Make sure it's not working on my end. Is anyone able to stop the recording from their side? No?
No, I don't think so. We can do it. Salim, thank you for the
Yeah,
session.
yeah,
I
no
have
problem
to
at all.
leave now.
Uh,
My
yeah,
kids are
yeah,
in
yeah, yeah, no
room.
problem, no
Okay.
problem, Murtaza.
Okay.
Do your,
You
yeah,
are-
do your best, no problem. Thank you very
Thank
much
you
for
so
your
much.
help. Yeah, no
Lovely.
problem at all. Allah Hafiz, Allah Hafiz. So I think I will conclude, and then I will put I will put the recording in the YouTube channel. Okay. If please, if anyone is there.